Hello everyone, my name is Dr. Ankita Singh, Reader, Department of Oral Pathology and Microbiology, BBDCODS. Today's lecture is on permanent maxillary first premolar. Maxillary first premolar, they are posterior to canine and anterior to molars. Maxillary first premolar has two cusps, buccal and lingual cusp. Buccal cusp is 1 mm longer than the lingual cusp. Then there are contact areas mesially and distally. They are present about at the same level. The chronology. First evidence of calcification 1.5 years to 1.3/4 years. Enamel completion is at 5 to 6 years. Eruption 10 to 11 years. Root completed 12 to 13 years. These are the dimensions of the tooth. Cervico-occlusal length of crown 8.5 mm. Length of root 14 mm. Mesiodistal diameter of crown is 7 mm. At the cervix, it is 5 mm. Buccolingual diameter of crown is 9 mm. At the cervix, it is 8 mm. Curvature of cervical line, mesially 1 mm. Distally, it is 0 mm. Now the nomenclature. In universal system of notation, right permanent maxillary first premolar, it is denoted as 5. Left is 1, 2. In Palmer notation, left and right side first premolar would have the same number as 4, but the right one would have symbol which is given in the picture, and the left one also has the symbol you can see in the picture. In international notation, right permanent maxillary first premolar is designated as 1, 4 and left one is 2, 4. Now you can see the graph in which all the aspects are given like buccal aspect, lingual aspect, mesial aspect, distal aspect, and occlusal aspect. So it is easy if you learn it from the graph. Now this is the picture which is showing the buccal aspect of permanent maxillary first premolar. It has two cusps, buccal and lingual cusp, but from the buccal aspect you can see only a single buccal cusp and you can see the buccal root. So buccal aspect, crown is roughly trapezoidal. Buccal cusp is long with pointed tip resembling the cusp of the canine. The mesial slope of the buccal cusp is longer than the distal slope. You can see it in the picture. And this arrangement places tip of the buccal cusp distal to line bisecting the buccal surface of the crown. The crown exhibits little cervical line curvature. Mesial outline, it is slightly concave from cervical line to mesial contact area, as you can see. Distal outline of crown below cervical line, it is comparatively straighter than mesial. The buccal cusp is large and pointed tip is there. Buccal surface is convex. Strong development of middle buccal lobe is there. Then there is continuous ridge, which you can see from the cusp tip to cervical line. It is called buccal ridge. Contact areas, mesial and distal, they are present at the middle third. Buccal ridge present from cusp tip to cervical line on buccal surface and root 3 to 4 mm shorter than maxillary canines. Now this is the picture which shows the lingual aspect. You can see that from the lingual aspect, lingual cusp is visible and also part of buccal cusp is visible. This is your lingual cusp and this is the buccal cusp. And also lingual root you can see. This lingual cusp, it is also narrowing down. So lingual aspect, as I have said, crown tapers towards the lingual aspect here. Lingual cusp is narrower mesiodistally. Lingual cusp is shorter than the buccal cusp. Lingual cusp is smooth, spheroidal from the cervical portion to area near the cusp tip. So this is your lingual cusp. Sometimes crest of smooth lingual portion that terminates at the point of the lingual cusp, it is called lingual ridge. Small portion of buccal cusp can be seen from this aspect as lingual portion of crown is narrower, that I have already told you. Cervical line is regular, slight curvature towards the root is seen. Mesial and distal outline is convex, then continuous with mesial and distal slope of lingual cusp and straightening out as the join mesial and distal sides of the root. Your lingual cusp not as long as the buccal cusp. Also, tip of both cusp with mesial and distal slopes are seen. Apex of lingual root more blunt than buccal root apex. Now this is the mesial aspect. From the mesial aspect, you can see two roots, you can see bifurcation, you can see two cusps. Now you can see that lingual cusp, it is shorter than the buccal cusp. Buccal cusp is lengthier. This is your buccal cusp, this is your lingual cusp. Also, you can, from here, near the mesial marginal ridge, you can see mesial marginal developmental groove from the mesial aspect. So this is the diagram which shows your mesial aspect. So you can see buccal root, as I've already told you, lingual root. You can see buccal cusp, lingual cusp, mesial contact area. This over here is mesial developmental depression, MDD. This is your cervical line. Slight curvature is seen. The mesial aspect, crown is roughly trapezoidal. From the mesial and the distal aspect, both buccal and lingual cusps are visible. Tip of cusp within the confines of the root trunk. You can see over here, these are the root trunks. So it is present within the confines, this tip. A well-developed mesial marginal ridge and a mesial marginal developmental groove is present. This groove continues with the central groove. So this you can see mesial marginal developmental groove, and this is your mesial marginal ridge. This groove is continuous with the central groove. Crest of curvature approximately at junction of cervical and middle third. Already we have discussed two cusps seen, one buccal, one lingual, two roots seen, one buccal, one lingual. Root bifurcation is present, and root bifurcation is half of its root length. Buccal outline curves below the cervical line. Crest of curvature often approximately at junction of cervical and middle third. Lingual outline is smoothly curved. Lingual cusp shorter than the buccal cusp. Mesial marginal ridge is seen at about level of junction of middle and occlusal third. Immediately cervical to mesial contact area, centered on mesial surface, you can see the mesial developmental groove. This mesial concavity continues apically beyond cervical line and joins the deep developmental depression between the roots, and they end at root bifurcation. Now this is the picture which shows the distal aspect. From the distal aspect, you can see this is your distal marginal ridge, and this one is your buccal cusp. As you can see, your lingual cusp is shorter. Then this is your buccal root, this is your lingual root, and this is your cervical line. Curvature of cervical line distally, we have read that it is 0 mm. From distal aspect, developmental depression or groove not evident on this aspect. Instead, it is convex at almost all points, but if present, it is shallow. The curvature of cervical line is less. Root trunk is flattened on distal surface above the cervical line with no outstanding developmental signs. Bifurcation of root is abrupt near apical third with no developmental groove. Now this is the picture which shows the occlusal aspect. From the occlusal aspect, you can see more of the buccal surface can be seen than the lingual surface. And you can see the central groove. You can see the triangular fossas. And this central groove is continuing as mesial marginal developmental groove towards the mesial side. Now, occlusal aspect is roughly hexagonal in shape. It has 6 sides. Mesiobuccal, mesial, mesiolingual, distolingual, distal, and distobuccal. The buccolingual dimension of crown is much greater than the mesiodistal dimension. Crown is wider on the buccal surface than on the lingual surface. Occlusal surface is circumscribed by cusp ridges and marginal ridges. So you can see all the six sides: distobuccal, mesiobuccal, mesial, mesiolingual, distolingual, and distal. So it is hexagonal in shape. So this is the picture which shows mesiobuccal cusp ridge, distobuccal cusp ridge, distolingual cusp ridge, mesiolingual cusp ridge, mesial marginal ridge, distal marginal ridge, mesial triangular fossa, distal triangular fossa, central groove, which continues as mesial marginal developmental groove. So mesiobuccal and distobuccal cusp ridges are in line with each other and even in straight same alignment. Distobuccal cusp ridge is buccal to mesiobuccal cusp ridge. In line of vision, in occlusal surface, more of buccal surface can be seen. Like you can see in this picture, more of buccal surface of crown is seen in comparison to lingual surface, and no supplemental grooves can be seen. Crest of distal contact area is buccal to that of mesial contact area. Then there is central developmental groove, which divides the occlusal surface buccolingually and joins mesial marginal developmental groove. Within the cusp ridges, marginal ridges, the following are present. I have already told you: central developmental groove, mesiobuccal and distobuccal developmental groove, mesial marginal developmental groove, mesial and distal developmental pit, mesial triangular fossa, distal triangular fossa, buccal triangular ridge, which is prominent, and also lingual triangular ridge. Now the roots. Most maxillary first premolar have two roots, but 1 and 3 roots can also be seen. But mostly we will say permanent maxillary first premolar has two roots, buccal and lingual root. The buccal portion of root resembles canine. Root, when viewed from proximal side, shows big trunk and bifurcation area from where the buccal and lingual roots separate. Developmental depression is seen on the mesial aspect of the trunk. So this is about the root. So this is all for the lecture. Thank you.